good morning, or good afternoon, or good evening. That's the great thing about campcasts. You can listen to them anytime. This is IH743, and this is the campcast on managing drug supply, and I am James Wolfe. In this campcast, I'll be sharing with you some of my experience and thoughts on managing drug supply for global health programs. My experience with pharmaceutical supply management began in the early 80s. Management Sciences for Health had identified pharmaceutical management as a key public health issue. The founder of the organization, Ron O'Connor, and a physician completing his service with the Indian Health Service, John O'Quick, now MSH's president, provided the first systemic and comprehensive assessment of managing drug supply in their now classic reference called Managing Drug Supply, Selection, Procurement, Distribution, and Use of Drugs. The cover of the book is on this slide, and it is a very comprehensive and excellent reference which I recommend to you very highly. I was working for MSH as an advisor to the Moroccan Ministry of Health when this book was being written, and I had an opportunity to explore and develop with my colleagues in Morocco many of the ideas covered in this book. During my time in Morocco, my colleagues and I completed the first analysis of the drug management system, selecting MOH facilities in 29 provinces and conducting a comprehensive drug management assessment. Based on this study, we worked with the National Control Laboratory on improving supplier selection, applying both Venn and ABC analysis to improve procurement, developing an essential drug list, creating standard treatment protocols, improving the MOH's ability to estimate their drug requirements, and in developing training and systems for improving drug warehousing and inventory management. Well, let's look at the objectives for today. Drug management is different from management of other commodities. The efficient and effective management of drugs can improve important public health outcomes and reduce expenditure. The activities of the drug management cycle, selection, procurement, distribution, and use of drugs, are also interdependent. The optimal functioning of the cycle requires the careful management and coordination of these activities. Like any public health intervention, indicator-based assessments for monitoring and evaluating the performance of drug management is critical. In this session, we are going to explore the value of being able to evaluate the performance of the public sector drug system and the challenges in achieving equity and financial sustainability. Managers will be required to improve the efficiency of their programs, aim for the most rational use of drugs, and develop mutually beneficial relationships with the private sector to assist in ensuring the availability of important drugs to the public. Here's what we'll cover in this session: the importance of drugs for public health, the drug management cycle, the ways that program managers can improve drug management, and some of the major challenges in making drugs affordable and accessible to the public. We'll finish up with a summary of the things we have talked about. Why is drug management important? Managers, health workers, patients, and politicians are all interested in proper drug management because drugs can save lives and improve health. Simple and effective treatments for some of the most common public health problems are now available at relatively low cost. But in spite of this realization, it is shocking to discover that in the 1990s, nearly 50% of the population in developing countries lacked access to these essential drugs. Ensuring public access to affordable drugs in the context of extremely scarce resources is our challenge. Drug management is also extremely important because incorrect use of drugs can make them harmful. Incorrect use can also add to treatment costs by requiring the use of more expensive drugs for prolonged illness or complications. Some experts estimate that in the United States, the improper use of drugs is responsible for a significant amount of morbidity and mortality. They estimate that health programs could expect up to a 60% reduction in costs if drugs were managed effectively. Consumers often don't choose the drugs they buy. Physicians or health workers make this choice for consumers. Sometimes the decision is made by a drug vendor with no formal training. And in either case, consumers must trust that the best choice is being made. When consumers do choose the drug, whether it's a prescription or non-prescription medication, they're not likely to be able to judge the therapeutic value of the drug. They don't usually have adequate information about the drug or sufficient knowledge to correctly interpret such information. Similarly, health workers may lack access to adequate information about drugs, or they may not have been trained to assess the information that they do receive. Conversely, consumers generally do not know the consequences of going without a needed drug. This may lead to consequences that are quite serious. For example, untreated diabetes may lead to blindness and the amputation of feet, or untreated hypertension may lead to a stroke. Fear of illness can lead to poor purchase choices. Fear is a powerful motivator, and people tend to have a lot of faith in medicines. Some of the problems associated with the situation are overdosing. If some medicine is good, then twice the amount must be better. Unnecessary use. If the drugs don't do me any harm, they might do some good. And underuse. If the medicine can kill worms, it must be very potent, so I will take only half the dose. Fearful consumers are also vulnerable to phony drug vendors who may offer them drugs that are either not have no active ingredients or are just plain toxic. Drugs cost a lot of money. However, because of their importance, people are willing to spend their money for drugs. In fact, drugs represent a major out-of-pocket expense. We know that as household income increases, expenditure for drugs also increases. If you take a look at the budget for a Ministry of Health, you will find that drug expenditures are second only to personnel salaries and benefits. Drug expenditures can represent 20% of the total national health expenditure and 60% of total recurrent health expenditures. It is likely that much of this expense is not necessary, given our understanding of the costs and preventable drug-related illnesses. Availability of drugs in health facilities promote trust in the health system and increase individual engagement with health services. Studies have shown that patients will travel long distances to seek health care in facilities that have drugs. Patients may not come to a health center if drugs are not available. One survey in Asia showed that drugs were valued more than healthcare workers were. In other words, the availability of drugs is the main reason for health services utilization. We're going to take a look at the drug management cycle now. Drug management involves many activities that have been carefully coordinated to ensure that the right drug of good quality gets to the right place when the patient needs it. These activities can be divided into 5 main components: drug selection, procurement, distribution, use, and management support. These components operate within a political, social, cultural, and economic context that influences the nature of the activities, but not the nature of the relationships. I want you to take a minute now to list the management activities that fall under each of these 5 components. So, in a second, stop the camcast, take out a piece of paper, and write each component of the management cycle on that paper. And under each management cycle component, make a list of the management activities that you think go along with that management component. And when you're done, you can start the camcast again and compare your list with mine. Great work. Now, let's take a look at the different activities that make up the drug management cycle. For selection, I have reviewing health problems, identifying treatments, choosing the drug, dosage form and strength, choosing the levels of care in which the drugs can be used. Did you get all of those? Did you get any that I didn't have? Make a note and bring it to class with you. For procurement, I have quantifying needs, choosing procurement methods, managing tender offers, preparing contract terms, and assuring quality. For distribution, I have customs clearing, stock control, managing stores, and delivery. For use, I have diagnosing, prescribing, dispensing, and use by the patient. And finally, for management support, I have organization of the system, financial management, management information systems, human resources, management, monitoring and evaluation. In fact, this is pretty much the same list for all the major components of our program implementation course. All of the major components of the drug management cycle are interdependent. When the system is not functioning well, the important drugs will not be used as they should be. And if the system is functioning well, the proper drugs will reinforce the proper selection, procurement, and distribution of drugs. Good management and good managers support to make the system work efficiently, to ensure the availability of the essential drugs. A significant advancement in drug management has been the use of indicators that are standardized measurements of performance. In the photo on the slide, data is being entered into a computerized ARV drug use and stock management program that was developed in Zudadu Hospital in Ethiopia. Indicators have been developed to assess these 8 areas of concern: drug policy, formularies, budget and finance, procurement, logistics, utilization of services, quality assurance, and private sector participation. For example, procurement indicators seek to answer questions such as, is the public health system buying only drugs on an approved list? How much is being paid for drugs? Are techniques being used that result in the lowest possible prices? For logistics indicators, we often ask questions like, is inventory being managed to prevent overstock? Are stockouts and waste due to expiring drugs? Are the important drugs available at all times? We use indicators to seek answers to questions such as, are standard treatment guidelines being used? Are prescribing practices in line with recommended practices? Are drug policies regarding generic drugs being implemented at the clinic level? Developing a carefully structured indicator-based assessment helps identify potential interventions to improve the efficiency of the drug management system. There are two ways that managers can improve the efficiency of drug management, and these are, first, by improving the distribution of drugs within the population. We call this allocative efficiency, and by producing greater output for a given level of resource. We call that technical efficiency. Because drug management components are highly interdependent, the impact of an improvement in one component of the system will have an effect on the entire system. As an example, let's look at the impact on the system of developing a list of essential medicines or a national medicine list. A list of essential medicines provides a guide for the procurement and supply of medicines in the public sector. Many international organizations, including UNICEF, UNHCR, and UNFPA, as well as non-governmental organizations and international nonprofit supply agencies, have adopted the essential medicines concept and base their medicine supply system mainly on the essential medicines model list. When Morocco implemented a new policy with a national medicine list specifying the drugs and the formulation and level of use of each drug, there were many cascading improvements. Adopting the list helped focus the MOH on the most important drugs to procure. And because selection was based on important health problems, the new formulary required improvement in estimating the quantities of those drugs and the best source to procure them. Here's an example from Latin America on the impact of standard treatment guidelines during a cholera epidemic. Applying standard treatment guidelines that reduced the use of ineffective, inappropriate, or expensive drugs lowered the cost of treatment by more than half. In this example, several small countries in the Eastern Caribbean with little individual procurement power reduced their expenditures by pooling resources. They developed the Eastern Caribbean Drug Service, a nonprofit organization formed by 9 country governments, and sought lower prices through collective bargaining. This improved their drug purchasing efficiency through bulk purchasing. Countries in the ECDS observed an 18 to 65% decrease in the amounts spent on pharmaceuticals. Before we finish this Campcast, let me share with you some of the key lessons learned over the years in drug management. First, wise drug selection underlies all other important improvements. Second, rational drug use requires more than drug information. Third, systematic assessment and monitoring of the drug management system is essential. And finally, effective management saves money and improves performance and ultimately saves lives. In many situations in which a private pharmaceutical sector has developed, it is relevant to think about how the private sector can help the public sector in assuring the availability of drugs in the public sector. Efficiencies can be obtained by capitalizing on some of the services that the private sector can offer at lower cost than the public sector. For example, in many low-income countries, over half of all drugs are sold through the private sector. Efforts to improve the availability of drugs through the private sector include establishing licensing conditions that require wholesalers to provide essential drugs to drug outlets in all geographical areas. Alternatively, licensing conditions can offer incentives for providing services in remote areas. To sum up, here are the key points. Policymakers, practitioners, patients, and managers should care about drug management because drugs are expensive. The financial and clinical costs of using drugs incorrectly or not having drugs available are extremely high. The system of drug supply is complex and requires coordination. We will look forward to seeing you in class, where we'll have the opportunity to further develop these basic concepts with some exciting class activities. So that's it for now. Hoping to see you charged up and ready to go as we begin our module on pharmaceutical management. Take care and have a good morning or afternoon or evening or whatever time it is for you. See you in class.